Happy birthday, Dr. Richard Okoye. Let me join the millions of people who want to celebrate you at the moment, and rightly so, seeing that you have done so well, defining all the odds that is militating against the delivery of healthcare systems.
While the World Health Bodies hope to achieve universal health coverage by 2030, meet a Nigerian doctor that provides the solution in 2024. In this occasion of his birthday, join us to celebrate Dr. Richard Okoye, the doctor that built the first fully digitalized hospital in the world, a hospital devoid of human errors. He is the medical director of Civil Life Mission Hospital, an ISO certified hospital group with amazing successes in kidney transplant, knee and spine surgeries, heart intervention procedures, IVF, and so on.
With what I could describe as consuming passion, uncommon inspiration to save lives, my MD, Dr. Richard Okoye, left for the United States with an idea that no one thought was possible. Today, we use the first EMR that helps doctors to make an accurate diagnosis, suggest investigations, and treatment of patients according to international standards of medical practice.
Dr. Richard Okoye, amongst others, invented BP Monitor with SIM card technology, capable of transmitting real-time data to a patient's doctor or hospital of choice.
Immediately after speaking with Dr. Richard, I realized a few unbelievable things about him. First of all, he's not only brilliant in just the medical arena in which he's studied for many years. Surprisingly, he was very technologically savvy in both the AI and the IT space as well. To say the least, I think the man is absolutely the pride and joy of Africa. To come over to America and bring something so advanced with such relative ease, and to already have things prepared is a testament to who he is as a man.
I met Dr. Richard Okoye in 2009 when he was just a dreamer, just trying to make Nigeria a dream destination for medical treatment. My greatest experience with Dr. Okoye was when he rejected an offer of $20 million from a corporate group in Dubai for taking over Civil Life Mission in 2012. I was surprised when his reply to the offer was that vision is a calling and not about money. Ever since then, I have been with him, trying my best and doing my best to support his dream for Africa. I am very sure with such people in Nigeria and Africa that Nigeria will be a great nation and Africa a great continent.
Dr. Okoye now has his eyes on improving Nigeria's life expectancy from year 2025.
Here is the catch: making professional healthcare delivery available and accessible to those in rural communities, particularly women and children, will make all the difference. And our technology is here to produce the magic. It's gonna happen in our time.
On behalf of your lovely staff, we say congratulations and happy birthday, boss and true leader.
So in this interaction with you today, we would like to visit some of your claims you've made, even though I have seen some of them, but we would like to explore some of these claims you've made. The universal health bodies have projected that by the year 2030, all things being equal, that there will be universal health coverage, which means that there will be healthcare available, accessible, and affordable for all. Now, if you come to the Nigerian context, all things being equal, we found ourselves here challenged with medical staff and doctors who are leaving. We also have the issue of local government and communities, primary healthcare systems almost collapsed totally. Not to mention insecurity and also the issue of electricity that has continued to prove themselves difficult in this region. How is it that you've been able to deal with these issues and now say that you have been able to deliver universal healthcare coverage in the year 2024?
Yeah, and thank you for coming. I appreciate your compliments. And I must say that your question is quite brilliant because you must have made relative research to understand the challenges to this much you have actually pointed out when it has to do with universal healthcare coverage. All right? Yes, it was by World Health Bodies, anticipated or put up a projection that by the year 2030, that universal health coverage where healthcare should be available, accessible, affordable also to all and sundry. That actually was projected based on certain indices, which of course should be progressively positive. It is very fundamental for you to be able to understand the etiology or the cause of a problem before you think about the solution. All right? Having been able to identify the fundamental problem when it has to do with healthcare delivery, and that has to do with the issue of manpower. Especially, you talk about the issue of doctors' availability. So, when it has to do with healthcare coverage of a nation, the World Health Organization recommended that for you to have a positive coverage of your health system, at least you should have one doctor to a ratio of 600 people, 1,000 even magnanimously put in place right now. Nevertheless, in Nigeria, from the current statistics, is one of 6,000 people, if not more, in line with our exponential population growth. So you look at that is a fundamental problem, and solving this very problem become our goal when it has to do with the issue of the solution we provided. Now, here is the catch. What are the things doctors normally do? That's just the first thing. The fundamental thing required for you to say this is a doctor is that this very doctor has a capacity in him to be able to ask you certain questions, and from the question he will ask you, which we call clerking or taking history, gives him an idea what is potentially killing you in terms of illness. That is to say, when you say, I'm having chest pain, the doctor fundamentally will scan within the differential diagnosis the possible differentials that can cause cough as a symptom. So all the questions he will ask you will be tailored towards ruling them one by one. You get that? Right. Having established that, we know that now we are challenged that there's no doctors not available. All right? How do we start? So we built an application which mimic all of those questions doctors ask, nevertheless, in the language of the people. Having answered those questions in line with the professional know-how of a doctor and send it to the doctor, questions become limited. Even if on phone, on a video call, madam, you say you have this, yes. Or your baby is stooling, yes. It's getting weak, yes. He stool blood 5 times. He said, no, I didn't say so, meaning that patient didn't understand the language, didn't understand the question nicely. So the doctor now can modify based on the actual event, based on the patient's understanding. And at the end of the day, the diagnosis can now come out. Doctor can comfortably send the drugs based on the fact that your baby may have a problem or diarrhea. Are you with me? Okay, take this very drug I'm sending to you now. So we build what is called local chemists, or what is called local pharmacy or community chemists, that it goes straight to their own system, and right there in their own system, they can get the drugs, take it and review the way they feel. The doctor can see it also remotely. Most important thing here is that these people are receiving professionally guided medication, all right, amongst other benefits on what we have already packaged in this particular endeavor.
Sorry, Dr. Richard, let me interrupt you here. You do know that what you're projecting here demands the use of internet and data. I mean, we're talking about rural areas here now, when even in urban centers, we're still challenged with the availability of internet use and data. So how do you deal with that? How do you mitigate that problem?
The truth of the matter is that you are right. Internet is the driver of the future of healthcare, future of everything we are doing today. Whichever business or whichever area of endeavor anyone is, he should be able to know that internet is coming to be able to fight fundamentally whatever you think that you already know today. So that is obvious. Of course, for a doctor to be in the city to be able to help those in the community, it is also a challenge. If the internet is not there, internet is not stable. Now, that actually was our primary challenge, because I recall during COVID that some communities in suburban area of United States, they were, because they used to send blacks over there, but during COVID, the number of people turned that off and down. So I was just thinking and said, what was going to be the fate of those people living in those communities? While thinking about them, it was so clear that that is exactly what we have with or without COVID in our rural communities. All right. So, and I was thinking about what is called radio frequency ring synchronization. Do you understand me? When you synchronize two radio frequencies, that is going to be in position to, even if an internet in the city, I can transmit that internet in the rural community. All right, since radio frequency can run up to 100 kilometers, microwave can go more. Now, coming back, I realized, having done it and it works in between my house and my hospital, the internet I use in the hospital, I use in my house, but there's no internet in my house. But that was still a challenge. And what is the challenge? The topography of our country is not same. It goes up and down. In other words, for you to achieve such a feat, you're going to mount a lot of mass here and there, or you're going to be in position to be hiring and all that, which can be too expensive for anybody to imagine. So on the start of SEM, an idea came, and that was an idea. Telecommunication companies, NTN, Glo, and a number of them, they have all gone. Good job. I must commend. Good job to most of our rural communities. Most of us travel to the villages and still be able to have access. All right. So I got this inspiration. I said, mount on the wings of telecommunication companies. Any way they reach, you can reach there also. And that's how we started developing computer. We have our own computer developed that has Synca technology.
Wow.
Yes. So it does not also require them charging the recharge and all that. We can recharge the data remotely. Do you get that? So right in the city, we also built a battery, considering the issue of electricity. All right. The battery can carry you for some hours, even if it's a little solar, can complement the strength of that particular health center, and also the chemist, the community chemist. You get that? So having been able to achieve that, today, the system can be kept in any village as long as a telecommunication company have reached that very village. Going further, we have been able to work a very strong partnership with Starlink, where in certain location we can be in position to wire them up and still be able to have internet, good speed, that could be able to deliver this, making it happen. So it is something we say it is done. It is not yet to be done. It is available with this very ability for them to answer basic questions. You train anybody, they can ask, even with a person with a baby, you could ask the question and all that, and it could be communicated to the doctor in this thing. And as a matter of fact, I said, our doctors go nowhere. Those they say they are out of the country, they are not out, they are within. We are living in a global village with the aid of internet. All right? So there are a lot of our doctors. They left the country, but that patriotism is still within. So a number of them can still be in position voluntarily support their own people through those. It's not a difficult thing. A doctor in his confidence can open his phone, see traffic or whatever is happening, and could be in position to support and send. They get their drugs. Most importantly is to get the right diagnosis and the right treatment. All right.
Let me ask this question here. You do know that there is still the issue of physical examination. You know, traditionally, we know doctors to carry their stethoscopes around. They need to listen to your heartbeat. Sometimes they need to look into your mouth and physical examination. So how does this proposal, this solution that you're providing, fix this problem of physical examination?
That's a very brilliant one, Annie, and you sound quite intelligent, let me admit here. Yeah, quite intelligent. Now, but we look at it from here, all right? It's very essential for the reason we are called doctors, all right? But we are meeting a difficult situation here. The doctors are not available. So let us say, kudos to the possibility that contrary to just going to the chemist and buying the drug, there is a professional support for which they are getting this and getting the right thing. All right? First, we didn't stop there. We know that this question also is necessary to be addressed when it has to do with the issue of assuring that the patient gets some level of better professional support. Okay. So we also coming up with a stethoscope, which we're also synchronizing into this system, all right, in such a manner that those people can be addressed. You know, just when you look at the chest of somebody, I can tell you, put that stethoscope here, put that stethoscope in this direction. As the sound is up there, it can be transmitted to the doctor to hear. Amazing, isn't it?
Real time.
We're gonna see the wonder of the
wow.
You know what I mean? Yeah. It's a passion-driven thing, and you know, when you have this kind of passion, there's a way God made provision, makes some certain incredible solutions available. Yeah. Now, we also look at the issue of children, all right? Now, in this case of these very children, what happened in that very case, you know, for some children, the issue of tonsillitis, you know, pharyngitis, the enlargement of the tonsils, and all those kind of stuff, all right? Now, we have been able to create a camera. Beautiful experience. That camera goes into the mouth. You can open the mouth of the child, just listen and look at the tonsil, and the image is transmitted to the doctor wherever. So you can even see if there is an enlargement of the tonsil or if there is something in that very regard. Do you know this kind of a thing? So to a very large extent, some of those basic things that the doctor otherwise ought to be done can be technologically, with some other devices we are also coming on board to be able to achieve, and that can be transmitted. By so doing, we are optimistic. You know, when the body to declare 70 years life expectancy for Nigeria, 2025 upwards, I wasn't building castle on the moon. It wasn't as extravagant exaggeration as it were. I saw that practicality, and we are very confident that that can be made possible. Yeah.
While the World Health Bodies hope to achieve universal health coverage by 2030, meet a Nigerian doctor that provides the solution in 2024. In this occasion of his birthday, join us to celebrate Dr. Richard Okoye, the doctor that built the first fully digitalized hospital in the world, a hospital devoid of human errors. He is the medical director of Civil Life Mission Hospital, an ISO-certified hospital group with amazing successes in kidney transplant, knee and spine surgeries, heart intervention procedures, IVF, and so on.
With words I could describe as consuming passion, uncommon inspiration to save lives, my ND, Dr. Richard Okoye, left for the United States with an idea that no one thought was possible. Today, we use the first EMR that helps doctors to make an accurate diagnosis, suggest investigations, and treatment of patients according to international standards of medical practice.
Dr. Richard Okoye, amongst others, invented BP Monitor with SIM card technology capable of transmitting real-time data to a patient's doctor or hospital of choice. With his new app, My Home Clinic, and different hardwares that support telemedicine to rural communities, Dr. Richard is the founder of the first medical app, Dr. Save a Life app, that operates in different languages, including Nigerian major languages.
Immediately after speaking with Dr. Richard, I realized a few unbelievable things about him. First of all, he's not only brilliant in just the medical arena, in which he's studied for many years. Surprisingly, he was very technologically savvy in both the AI and the IT space as well. To say the least, I think the man is absolutely the pride and joy of Africa. To come over to America and bring something so advanced with such relative ease, and to already have things prepared is a testament to who he is as a man.
I met Dr. Richard Okoye in 2009 when he was just a dreamer, just trying to make Nigeria a dream destination for medical treatment. My greatest experience with Dr. Okoye was when he rejected an offer of $20 million from a corporate group in Dubai for taking over Save a Life mission in 2012. I was surprised when his reply to the offer was that vision is a calling and not about money. Ever since then, I have been with him, trying my best and doing my best to support his dream for Africa. I am very sure with such people in Nigeria and Africa that Nigeria will be a great nation and Africa a great continent.
Dr. Richard Okoye also supported various hospitals in healthcare improvement and equipment. As part of his human capital development vision, he has sponsored the training of doctors and nurses in super specialty courses abroad. Dr. Okoye now has his eyes on improving Nigeria's life expectancy from year 2025.
Here is the catch: making professional healthcare delivery available and accessible to those in rural communities, particularly women and children, will make all the difference. And our technology is here to produce the magic. It's gonna happen in our time.
On behalf of your lovely staff, we say congratulations and happy birthday, boss and true leader.
Still another question for you. Let me just still stay with this question here that has to do with these rural communities. We've mentioned everything so far about what you can apply for the community, but I've not heard what you have for pregnant women and babies, and I think that there might be something we're missing out here. So what is your solution to pregnant women in rural areas and babies?
Yeah, basically, I would say that, as earlier mentioned, when it has to do with the life expectancy of any country, of any nation, we are talking about the issue of mother and child, primarily. That's what this is, the foundation of life expectancy index measurement, all right? So now, looking at it from that particular perspective, we have been able to do a very extensive work for which we are now saying World Health bodies should be able to look forward. It may not be as bad as maybe imagined, you know. So looking at it in that particular sense, we have been able to build an application called My Baby and I. It's integral part of My Home Clinic. Okay. This application enables any pregnant woman anywhere in the world to be in position to have access. You get what I mean? Mm-hmm. To have access to a doctor out there. And what does it do? We give this opportunity through that application for a woman to be able to see the embryological development of her baby as week by week development ensues. Mm-hmm. Right? Going further again, we allow this woman to understand, I'm 32 weeks, I'm 17 weeks, all right? So we're able to build it in such a manner that the timetable of when are you supposed to take your anti-malaria, when you are supposed to take your tetanus toxoid, when you're supposed to take this. So the events of pregnancies are all itemized as they go on, all right? Furthermore, we have it in that same application where we have pregnancy checklist. Checklist in the sense that there are certain developments that happen in the body of this woman vis-a-vis the state of her baby that happen every week. So the condition of that woman is being asked with certain nice questions, any blood, any this, any frequent urination, all that, to rule out malaria, rule out UTI, rule out abortion, or all those miscarriages, and all those kind of things. Then we answer all those questions and submit it. The doctors in the same manner could be able to check it out and see this is the condition. Now, going further, is the aspect that has to do with the preeclampsia. That is the most worrisome situation when a woman that is pregnant and nobody is there to take care. If that woman has hypertension in pregnancy with evidence of protein in the urine, otherwise called preeclampsia, that particular woman is going to have crisis, may fit and die. So, particularly the reason why we have a lot of maternal mortality in this side of the world. So, addressing that, in one of the outreach programs, we went in a community where I saw a lot of pregnant women. So the idea came, okay, let's create a urine test strip that they can test wherever they are in the community, check it out by virtue of the color resemblance, and send it. The doctor can see to know when there is protein or not. Okay. All right? So we created the Dr. Save a Life urine strip. So that particular urine strip, as they now check it after 1 minute, they check it with a corresponding color and just keep it and submit. We're gonna know whether this very fellow has protein in the urine or glucose in the urine. So we pick them early from that village, considering that management of preeclampsia is a multi-specialty approach. It requires a physician, it requires endocrinology. You have a lot of fellows that need to be involved, all right? So knowing that, such women, we tend to pick them up as we have done for some of them. Some of them don't have money to be attended to, but we have to save the life. So when we make it to become on a larger scale, thousands of pregnant women will be saved. Come on.
Dr. Richard Okoye, I must say thank you very much for the time you've dedicated to take me through all of this. I must say I'm very impressed, and I wish you great success in all your endeavors.
Thank you for coming.
Thank you so much, sir.
I appreciate it.
All right.